you will hear that this monkeypox outbreak did not need to happen. There is a working vaccine that prevents viral transmission. The government had over 1 million doses of this vaccine since April. The government refused to release the vaccine when they could.
Act up, fight back, fight AIDS. Act up, fight back, fight COVID. Act up, fight back, fight monkeypox.
Like many people, perhaps even a lot of people here, I had an excruciating experience with monkeypox. It was so painful that I wasn't even able to sleep. I had to be prescribed narcotic painkillers just to be able to even go to sleep, and that was for almost a week. It was one of the lowest points of my life, I can say, with both mental and physical repercussions that are still lasting to this day. And I want to be clear about this. We have been failed by our government and its agencies in executing a timely and appropriate medical response.
And Jim All's Liberal Democratic Club. Thank you to them, thank you.
Sex workers are again being forced to the impossible situation of choosing between prioritizing their health or having enough money to survive. Sounds familiar? Yes, the same fucking shit happened a couple of months ago with COVID. What did the government do? Almost nothing. What is the government doing now? Almost nothing.
Shame, 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 shame.
It's really important to remember that when AIDS first struck in New York, even before it was known to be a disease, the first people that died of the disease were Black and Latino people in the Bronx, in Brooklyn, and in Harlem. And they were never noticed, they were never diagnosed. And it was only years later when those cases were actually identified retrospectively through epidemiology, which was too late for them and their communities.
The poorly thought out preparedness strategies serve as further proof of countless proofs that equity and inclusion of queer disabled people are not the integral part of their public health emergency operation. That must change. Queer disabled people have long been oppressed and discriminated against upon a system designed for white, straight, cisgendered, and abled men. The marginalized population is the last group to be considered in the crisis.
Which it didn't. And we now have recent FDA-approved injectable PrEP. We have a ring for women, and that is not getting to communities who need it.
It took me 3 weeks to access the vaccine. It took me 3 weeks every day trying to access a medication. This is a sign that perhaps our governments continue not to learn its lessons. Have we not learned our lessons from the AIDS crisis, which I might add is still ongoing? Did we not learn our lesson about the structural and socio-political and cultural failings in the response to the COVID-19 pandemic that has left over 1 million people dead in this country, and that's still happening?
Shame, 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 shame.
It means nothing that you allocate the vaccines if you don't get it to us and in our bodies. So we are demanding a real plan for this, and we are demanding more than the 20% of the national supply when we have the majority of cases here. We want all the vaccine that we need right here, right now.
Like we say in the chant, we protect us. And I say that because we had 2 allies in the state legislature who co-led a coalition.
It's great that we have more vaccines coming, but we needed those months ago. And the inaccessibility of the primary antiviral treatment, tecovirimat or TPOXX, for those who are suffering right now due to CDC red tape and incompetency is negligence bordering on cruelty. So I call on the CDC, FDA, White House, and all the powers that be to act on our demands and do whatever is required to immediately clear the vaccine stuck in red tape limbo, to increase the quantity of tests and decrease turnaround time, and make TPOXX readily available for prescription to suffering patients.
Does not make us a lot of money. Thank you.
It's the red tape. And you should be frightened. Because in the 80s, the same thing happened. When infections ravaged people with AIDS, rare infections, and the only treatments were at the federal government level, and we asked for them to save our lives, they said the same thing. They said, I'm sorry, there's red tape. I'm sorry, this is the way the FDA acts. But that administration was a homophobic, Republican, conservative shit administration. This administration says that they're our friends. This administration says that they care for gay people. Well, put down the rainbow flag. It doesn't mean anything, President Biden, if you don't care for our health.
Healthcare is a right. 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 Healthcare is a right.
More testing, more vaccines, more treatment, Miss Thing. More testing, more vaccines, more treatment, Miss Thing. More testing, more vaccines, more treatment, Miss Thing. And when I say Miss Thing, I'm of course talking about the US motherfucking government, who is not showing up and showing out for us.